Oh, thank you, Mr. President. Mr. President, ladies and gentlemen of the Senate. This isn't a subject I normally rise on, and I've been listening to this debate all day. Been in my seat, I've been listening to everything said. But I think I have something different that I'd like to talk about. As some of you know here, I've been on the board of directors of a small faith-based hospital for quite a few years. And I stop into that hospital, not only as a board member, but as a visitor visiting a sick friend or relative. I was in the hospital this morning, visiting a sick relative, and I quite often will go over to the nurse's station and see how things are going, talk to the doctors, I know them all, ask them what's going on. Today was a little bit different, because they wanted to know from me what was going on. They wanted to know what was the matter with the air that we breathe up here to make us think so funny sometimes. And I had to agree with them that some of my friends think a little different than I do, and I think a little different than they do on some of these issues, this being one of them. I sometimes think I'm one of the clergy there, because I'll go from room to room visiting some of the patients, because they're my constituents, but they're my friends. And I know quite a few of them. And I will ask them, Mr. President, what's going on, how they feel, what happened. I'll ask the nurse, the doctor. And quite often, I'll be talking to, and it could be a single mom with 2 kids, it could be a 40-year-old guy, it could be anybody. It could be a senior, and they will tell me. What's sad sometimes, though, is when I'm talking to somebody that I know is out working 60 hours a week, in low-wage jobs, some people call, we got a bill coming around, I guess it's going to be called Right to Work for Less. And they work for those kind of jobs, and they can't really afford health insurance. And the doctors tell me and the nurses tell me that that same person who works real hard and can't have health insurance, because they didn't have their annual checkup, their illness, their disease, their problem, which could have been found at one of those, wasn't able to have the relationship with the doctor that we all have, because we all have nice insurance. We have relationships with our doctors, and we go in and we have our annual checkups, and we try to do the best we can at trying to live a healthy life. Some other people aren't quite so fortunate. And they tell me, Stan, what's wrong up there? Because it seems so simple to us that providing these people that work, providing the people that need it, that relationship with their doctors so that we can see these problems early on will prevent an awful lot of suffering. We'll be able to do it much, much cheaper. This poor woman here came in Sunday in an ambulance in the emergency room. If she was my patient and would have come in last week, I'd have had her walk over from my office, and we would have admitted her, and we would have had her out of here in a day. Now she's going to be in here a week, and it's going to cost us a lot more money. Mr. President, these are the things that my constituents are asking me. These are the things that my doctors and nurses. Now, I had the benefit of being on the board, so they might talk to me more, but I doubt it. I've been going and doing this for so long. And going to see the patients and asking how they wound up being a patient and finding out that quite often, had they had some sort of health care, had they been able to have a relationship with their doctor, if their family had had the opportunity, we would have saved ourselves a ton of money. So when we start looking at what this really means, and you go into your hospitals and you talk to the staff, I always say, even in this building, talk to the staff, you'll learn about things. I used to be staff. Go into a hospital, talk to staff, you might learn something. Go in and talk to those patients. You don't have to be a Catholic priest going to see the patients. You can just go in and talk to them, as I do, and you learn an awful lot. Let me tell my friends, ladies and gentlemen of the Senate here, Mr. President, I'm really disappointed that when somebody asks me what kind of air we're breathing up here, because to them, they think we're just a little bit off, that it sounds so simple and is so simple to get coverage for 70,000 Mainers covered by the federal government for a minimum of 3 years, and to be able to sunset if it doesn't work at the end of those 3 years. To me, it just sounds like the people at home are right with breathing some funny air. So thank you, ladies and gentlemen, my friends on both sides of the aisle, and Mr. President.